This is NDTV, and you're watching NDTV 24/7.
Welcome. You're watching Living with COVID. As we grapple with the new normal in our daily lives, we have a panel of expert doctors who will answer questions on how you can resume your daily activities in the midst of this pandemic. We have Dr. Vinayak Harale, consultant endocrinologist, Supreme Clinic, Pune, joining us on the broadcast. Also, Dr. Dharmesh Solanki. He's a senior consulting cardiologist at the Wockhardt Hospital in Rajkot. Dr. Solanki, if I can begin by asking you, I think one of the biggest questions that a lot of people are grappling with is, dealing with other diseases in the midst of a pandemic. Is it safe, for instance, to go back to a hospital or clinic for follow-ups, checkups, or even investigations? What's the advice that you'd like to give people? Is it safe to go back to hospitals or clinics and access healthcare? Should people still wait and opt for teleconsultations?
Yeah, it's a very good question because majority of the patients were locked down for last 3 months and they have either comorbid conditions like hypertension, ischemic heart disease, or associated diabetes or a kidney problem. I would give one of point blank advice. If you are asymptomatic, you don't have any new symptoms in these last 3 months, you can go on a video consultations with your consultant, and that should be sufficient enough to improve your drugs list or to find out something which you are missing out. But if you had any symptoms in these last 3 months, suppose if you have a chest discomfort, you feel out of breath or you are exhausting, then you have to visit your consultant, take prior appointment, and make sure you follow all the social distancing, which includes N95 mask, 6 feet distance, and probably you can come back from the hospital or a clinic and wash your clothes and take a bath.
All right. Let's talk a little bit about, patients with heart conditions. Are they more likely to be infected with the COVID-19? Once they are in fact infected, are the chances of their symptoms being more severe and, chances of complications, for instance, higher? What's the advice that you'd like to give heart patients?
Yeah, first of all, let me clarify your issue number one. There is no increased chance of heart patients to acquire COVID. Suppose a normal patient has the chance of acquire COVID, the same incidence as the heart patient has. So it is not true that heart patient has a more chance of getting COVID infection. Now coming to your second question, that COVID infection has a higher mortality and morbidity in the form of there is a complications that has been found from the China study that patients with the heart problem like hypertension, congestive heart problem, blockages in the coronary artery, or a valvular heart disease problem has a higher chance of mortality. Why? Probably these are the older patients. They have associated diabetic, because if you look hypertension patients, 30% of the patients may have associated diabetes, 20 to 30% may have associated stroke or a kidney problem. So their body immunity is low. And COVID is a match between a virus and your immunity. So if your immunity is good, you are protected. If your immunity is less, there is a more chance of developing more type of complication and outcome may be poor.
What advice then would you like to give to heart patients, Dr. Solanki? How can they tide over these times? What are the big do's and don'ts? Because it's interesting. What you're saying is that the chances of contracting the virus are equal among all patients. But if a heart patient, God forbid, contracts the virus, and the chances of a complication are higher as opposed to, normal patients or those who don't have comorbidities. So what's the advice that you'd like to give them?
So first of all, if your patient's age is more than 65, ideally he should not go out of the home unless it is mandatory, like going to see the doctors or somebody which is very important work. Otherwise, he should be confined to home as far as possible. Number one. Number two, he has to continue all the medications, because there is a lot of fear that hypertension patients that these drugs are not to be taken, that increases the COVID incidence. No, all the guidelines, European, Canadian,
Right.
American guidelines says that these drugs should be continued. Number three, they has to be on healthy diet. They need to increase the protein intake, which improves the immunity.
Right.
Number four, they continue to do exercise, but in the open area. They can't go exercise in the gym, but they continue to go
Yes.
into the garden if it is open, and keep a social distance and preferably wear the mask. That is what I suggest to each and every patients who are a heart disease patients during this COVID pandemic.
All right. Very important advice there. Dr. Harale is back with us. If I can just come back to you, we've talked extensively about heart patients, but the other patients who are vulnerable at a time of a pandemic are, of course, those suffering from diabetes. How does the COVID-19 affect those, doctor, who are suffering with diabetes? Dr. Harale.
We all know that diabetes is an immunocompromised state. So, if the sugars are uncontrolled in diabetic patient, their immunity is compromised, and there are higher chances of developing comorbidities and mortality associated with the COVID-19 infection. So, to avoid this risk in diabetic patient, patient should control their blood glucose levels by monitoring glucose at home by using glucometer, and to keep their blood sugar fasting glucose below 130 and post lunch sugar below 180, and if possible we can also check the HbA1c at nearby lab, and to keep the HbA1c levels below 7%, so that there will be no or very minimal risk of morbidity associated with the COVID-19 infection. And the risk increases in those patients where the sugars are uncontrolled, age more than 65, or if there is associated other comorbidities are there. So in patients with diabetes, the blood sugar control is very important to reduce the risk of this infection.
But Dr. Solanki, meanwhile, if I can come back to you, we're of course, talking about heart patients with you. There are concerns about the ACE inhibitor and their use in cases of COVID-19. How safe are they? What's your opinion?
So this is the drugs which is extensively being used for hypertension patients, and it has been found by the various guidelines which I had mentioned, European, American and Canadian, and they clearly says there is no increased incidence of acquiring COVID those who are taking ACE inhibitor or ARB group of drugs. So please don't stop and please continue drugs. If at all you have a doubt, please take a telephonic or a video conference advice from your consultant.
All right. So, that's of course the use of ACE inhibitors. But what really do ACE inhibitors do, doctor, if you can explain to our viewers?
So ACE inhibitor is a drug which is used for hypertension, and COVID infection is happened because of that virus attached to the lungs and trachea ACE complex, or what we call as ACE receptor. And that receptors allow the virus to go inside the lung tissue, and hence there is a fear that I have a more ACE receptor because I am taking that drugs. So there is a little bit confusion which was circulated in the social media, but definitely these drugs are more helpful. Even if you are having hypertension, they usually even protect the lungs. There are studies that they act as anti-inflammatory, and the outcome of the COVID patients who are on the ACE or ARBs are better or equal to those who are not on ACE or ARBs.
All right. Also, Dr. Solanki, talking about the statin therapy, should it be continued in people with heart diseases who've also been detected with COVID-19? Is it safe?
This is a very good question because there is a lot of controversy, and the patient has a constitutional symptoms like fatigue, tiredness, excessive weakness, not able to getting up out of the bed. So people feel that statin should be stopped. No, statin has not only effect on cholesterol, but it has some beneficial effect which we use the word in medical science, pleiotropic effect. So other than cholesterol reduction, it has an anti-inflammatory effect, it has an antioxidatory effect, and it has a vasodilatory effects in the coronary artery. So if you continue statins, then it is better that your heart is get protected, number one. But remember, when the other antibiotics are being used, and particularly azithromycin, because now all this social media, which is a big university in the world, they have taught us that azithromycin and statin can sometimes result in muscle loss or muscle damage. So at that particular time, one need to be careful or consult your doctors that can I continue statin with the azithromycin or not.
Right.
Otherwise, it is a very safe drug.
All right, but I think the important advice here that you're giving viewers also is, to not believe everything that you read on social media or anything that's forwarded to you. It's always better, especially at a time like this, to always contact your doctor and act only under medical advisement. So I think that's very important advice coming in as well. Dr. Solanki, do stay on with us. We're going to slip into a very short break. We'll also try and reconnect with Dr. Harale on the other side. Both our doctors are going to continue to be live with us. Do stay tuned.
Knowledge Partner, USV, your reliable healthcare partner.
Amity University announces career counseling webinars in over 20 disciplines from 18th to 25th July. Earn insights on career opportunities from industry experts, Amity's senior faculty and alumni. An initiative by Amity to help students choose the right career path. Register now at amity.edu/career webinars.
इतना सब कुछ होने पर भी अपना हेल्थ इंश्योरेंस नहीं कराओगे? आज ही सही डिसीजन लो। मैक्स कूपा हेल्थ इंश्योरेंस के साथ 30 लाख तक का कवरेज सिर्फ 620 रुपीस पर मंथ में। अब नहीं खरीदोगे तो कब?
Morning, Captain.
Welcome aboard, Captain.
Can there be two captains?
If there's enough space.
The all-new 6-seater MG Hector Plus. It's a human thing.
Get back what defined you, woke you up to the truth. From knowledge knocking at your door to information with your coffee to go. Take a stand. Your newspaper should be in your hands. To get a copy of your daily newspaper, log on to wantmypaper.com. The Times of India. I want my paper.
ले आइए ओकाया होम इन्वर्टर बैटरी। इसकी एडवांस ट्यूबुलर टेक्नोलॉजी देती है क्विक रिचार्ज एंड लॉन्गर बैकअप। ओकाया, नेवर स्टॉप इंडिया।
कूका तुलसी गिलोय अर्क, इसमें तुलसी के साथ गिलोय भी है। इसका रोजाना इस्तेमाल आपकी इम्यूनिटी बढ़ाता है।
कूका तुलसी गिलोय हमारी इम्यूनिटी के लिए।
राजस्थान, यहाँ रिकवरी रेट 76% है, जो देश में है अग्रणी, और मृत्यु दर 2.2% से भी कम है, जो राष्ट्रीय औसत से कम है। केस दुगना होने की दर 31 दिन है, जो 21 दिन के राष्ट्रीय औसत से बेहतर है। 10 लाख से ज्यादा लोगों की टेस्टिंग के साथ एक्टिव केसेस को कम रखने में सफल रही है गहलोत सरकार। मुख्यमंत्री ने सबसे पहले गरीबों के लिए 5,000 करोड़ का पैकेज देकर लॉकडाउन में किसी को भूखा नहीं सोने दिया। गहलोत सरकार ने 20 लाख लोगों का आवागमन सुनिश्चित किया। 8 लाख लोगों के लिए निशुल्क श्रमिक स्पेशल बसें चलाई और ट्रेन का किराया भी वहन किया। मनरेगा में 53 लाख तक लोगों को रोजगार देकर देश में है अग्रणी। ऑनलाइन राजकौशल श्रमिक एम्प्लॉयमेंट एक्सचेंज पर 53 लाख श्रमिकों और 11 लाख नियोजकों को जोड़ा। सामान्य बीमारियों के रोगियों तक 550 मोबाइल ओपीडी वैन पहुंचाकर किसी भी बीमार को नहीं होने दिया लाचार। कोरोना को हराने में अव्वल है गहलोत सरकार।
मदुरई से शिमला, पुणे से कलकत्ता, इंडिया के हर घर की जरूरत पूरी करने हर पिन कोड पे डिलीवर कर रहा है अमेज़न, पूरी हिफाजत के साथ। बताइए कहाँ आना है? अमेज़न, आपकी अपनी दुकान।
Let your little light shine. Let your little light shine for the world to see.
Welcome back. Dr. Harale and Dr. Solanki continue to be live with us. Dr. Solanki, if I can bring you back into the conversation as well. You know, one of the big issues that also ought to be talked about is, of course, the issue of anxiety, mental stress. At a time of a pandemic, people are scared, they're insecure about contracting the infection, they fear for themselves, their loved ones. At the same time, many people are restricted to the four walls of their homes, unable to freely move around. What kind of impact does mental stress have generally on the health condition and especially during a pandemic?
So that is a very good question, and since last 1.5 months we have restarted our OPD, and we are observing almost 50% of this population has this problem. So one of the biggest advice which I would like to give is always consult your doctors, talk to them, whatever the question you have, so that will reduce your anxiety and unnecessarily fear from the social media, number one. Number two, do not stick to social media too much because you are free, because social media is the one of the biggest culprit to increase the anxiety and fear about the disease and your friends and family. Number three is yoga, pranayam, dhyan, all the other alternate medicine is definitely of help to keep your mind calm and in the balanced situation. And these, we along with the regular diet, food, proteins and minerals and vitamin intake definitely will help you to reduce your anxiety status.
Dr. Solanki, I think, when we're talking about mental stress and we're talking about anxiety, I think these are, issues that are connected, of course, to symptoms, and they can manifest in physical forms, in any part of your body for that matter. But I think for heart patients, they ought to be especially more careful about hypertension, about mental stress, because it's linked directly to the heart. What's that correlation that patients need to be aware of?
So definitely once there is an anxious state, your heart rate increases, your blood pressure increases, and your shear force inside your coronary artery increases. And these all results sometime into the heart attack, sometime into the stroke, because there is a blood pressure increase, sudden increase, and it may result in the cerebrovascular stroke. And this anxious status is always correlated with the heart condition, which may sometime worsen. Number one. Number two, when you are passing through such a pandemic where anxiety may last for a couple of months, then definitely it affects your weight. And I had observed many of my patients has increased the weight by 5 kg in last 3 months.
Right.
So one needs to take care about your weight also, because obese patient has a higher chance of getting comorbidity or say mortality and morbidity out of the COVID. So one need to take a chronic anxiety as a very important aspect for gaining the weight.
Right. Dr. Harale, have you had a similar experience with your patients? Dr. Solanki has, of course, been talking about, the impact of COVID-19 on patients. Weight gain has been a huge source of, huge cause of concern, and, a source that has further compounded to many health issues. How can people, stay fit at a time when stepping out or going out or exercising outdoors, is a challenge? Gyms are closed, swimming pools at this time of the year are closed, physical activity outside is being discouraged. How can people stay fit?
Patient has to keep themselves fit by doing regular exercises at home, like yoga, meditation, or some functional exercises like cardio exercises, or those whom it is possible to order some treadmill or cycling machine equipments at home. They can do various cardio exercises. But without this equipment also we can do lots of exercises by the help of some online videos are there. So patient has to keep themselves fit, so that at least 30 minutes per day exercise is recommended. So 150 minutes is a minimum exercise per week is required, so that the immunity level will increase.
Dr. Solanki, I think, of course, exercise, pranayam, meditation, yoga, all of these, I think, have held the human race in general in good stead in many trying and testing times. But a lot of our viewers have also, had questions about dietary restrictions, the do's and don'ts. What should you be eating? What are some of the good food or good eating habits that you can adopt at the time of a pandemic, which also boost your immunity and help you lose weight?
This is a very good question, and majority of my patients on video conference or video call ask me the similar question. So first of all, what we call as a balanced diet, which contain carbohydrate, proteins, fat, minerals, vitamins. So we need to reduce our carbohydrate intake a bit, which is the major culprit for increasing your weight gain. We increases our protein intakes, so that will increase your immunity and boost up to fight against the COVID. We increases the mineral and the vitamin intake by taking more fruits and vegetables, particularly raw vegetables or raw fruits, which are definitely of help to build up your immunity against the COVID. There are also some sort of a ukada, which the words now famous even in the literature also, which has been provided with the help of the various spices and haldi and other things. That also can be also used along with this food regime to improve your immunity.
All right, very interesting, because Dr. Harale, and I want to just give you a chance to add to that as well, because what Dr. Solanki is saying is that you should reduce your carbohydrate intake, up the intake of proteins and vitamin-rich foods, so a lot of fruits and vegetables. But then, how does that play out if you are diabetes patients? Because sugar is also something, that has to be controlled and watched at a time like this. So would you then recommend patients to take supplements? Because a lot of patients in a lot of areas where there has been lockdowns, or, where accessibility in remote parts of the country to fresh fruits and vegetables has also been questioned. It's all regularized and normalized now. But, do you recommend people taking multivitamins or zinc tablets, for instance? Are supplements really the way forward?
This is again a very good question, which is asked by many of our patients, that shall we take multivitamins, or which supplement is better to fight this COVID-19 infection. So the simple answer I would like to give is that these supplements are there to improve your immunity and just to it's a source of antioxidant, but there are no studies that which says that it will prevent or avoid your COVID-19 infection. But yes, definitely to improve your immunity, to boost your immunity system, we can take the help of these supplements. Then which supplements are required? Like we can take vitamin D, 6,000 units once a week for 8 weeks, or supplement like vitamin B12 for a month, zinc zinc supplementations for a month, or vitamin C 500 milligram for maybe 15 days. But do not take over medication. So it should not be like continuously you have to take medications like these multivitamins. Otherwise, there are chances of some toxicities also there. So it's better to be under your guidance, the guidance of your local physician or doctor, so that there will not be overdosage of this multivitamins or supplementation. The three important things I would like to say: the diet, exercise, and medications. So we have to focus all these three things in this aspect. So regarding diet, we should increase the fiber and protein intake and reduce the carbohydrate intake, have more fresh vegetables, and have lots of water and home cooked food. Regarding exercise, I have already said minimum 30 minutes physical activity is required, including resistance exercise and also the cardio exercise with yoga and meditation. And as far as medication is concerned, stick with your whatever medication is prescribed by your doctor, and do not stop any medications without consult of your doctor. And if possible, maximum you can opt for the online consultation or video consultation, so that you can avoid the exposure to the outside. And also you can have a glucometer at home, and those who are specially having insulin as a treatment, they can monitor their sugars at home by at least 2 to 3 times a week, and they can inform their doctor and adjust the medications or insulin accordingly. So it is very easy to manage diabetes at home. Don't be panic. Just be have regular diet, exercise, and continue your whatever medications you are taking.
All right. So I think, that answers a whole gamut of questions on what should and shouldn't you be eating, what should you be doing, in trying to boost your immunity, manage your weight, and of course, maintain a general sense of well-being. Appreciate you both doctors, Dr. Harale and Dr. Solanki, for taking out the time of day and answering our questions. Thanks so much for joining us.